Well, problems within the Veteran Affairs Administration turned out to be much more widespread than previously thought. New emails from an employee at the Cheyenne, Wyoming VA revealed the staff there intentionally cheated the system. Quote, "Yes, this is gaming the system a bit, but you have to know the rules of the game you're playing. And when we exceed the 14-day measure, the front office gets very upset, which doesn't help us." End quote. Well, Secretary Eric Shinseki released a statement saying he just learned about all this yesterday, and he requested an independent investigation. But it turns out the VA officials have known about this, the improper scheduling practices, since at least December of 2013. That's the medical inspector investigated. So far, they've done nothing. The person responsible is still being paid. Joining me now with reaction is Vietnam veteran John Negrete, who is speaking out about his own battles with the Phoenix VA system in trying to get treatment for liver cancer, which he has. John, thanks for joining us this morning.
Good morning. Thank you for having me.
So you learned that you had cancer in your liver, and you, of course, want to get treated. You went to the VA. What happened?
Well, it started February 10th when I couldn't get up and walk one morning, and which has nothing to do with the cancer. But I called the Veterans Hospital after going to a chiropractor and a PT that didn't want to see me, and they said that I wasn't a patient there anymore, and I needed to go to a private hospital. And I've been a patient for the Veterans Office since 1975, since I got out of the service. Apparently, I didn't need any kind of care for 2 years, and that put me back in some kind of a list. So I went to the Scottsdale hospital, and they diagnosed me with cancer. I was there 5 days. I went to the Veterans Hospital then immediately and asked them that I needed to see a doctor about eradicating this cancer on my liver. They told me I had to be weighed on a list, a patient's list. And I said, well, why do I need a patient's list? I said, I've been seen here before. She goes, well, you haven't been seen the last 2 years. So I accepted that, and I waited 2 months. I still didn't get anything.
In the meantime, 2 months to see a doctor?
2 months to get on the list to see a primary care doctor.
Well,
the primary care doctor is the doctor that tells you who you can go see at a GI.
And at this point, just so our viewers don't have any misunderstandings, you'd already been diagnosed with liver cancer.
Absolutely.
That's unbelievable.
I have a 1.8 centimeter lesion on my liver. It's first stage, so I went there and I talked to the nurse that was in the Gold Clinic. She told me that I wasn't still on the list to see the primary doctor who was going to allow me to see a specialist, a GI. So me and my son, Chandler, we were walking down the hallway, and I started getting sick. I had chest pains, and I ended up in the emergency room, and I had some things going on with my heart. I guess it just upset me so much. I finally got into the hospital. There they did diagnosis to reaffirm, which I had brought them a disc from Scottsdale and Shea in February affirming that I had this cancer. And I was told, well, we can't accept the disc because it's not compatible to our computer system.
So as of right now, with this diagnosis of liver cancer, have you received an appointment for surgery? Do you have a surgery date from a doctor at the VA?
I was at the VA yesterday to finally see a primary care doctor. They still, at this point, did not have me scheduled for a radiation treatment to eradicate the lesion that's on my cancer. I was told by, let me finish. I was told by a GI doctor last week that he was going to rush this through. It was a gentleman that I have seen there before back in 2010. I have varices that the veins that go into my liver, they'll explode. And he said he was going to push this, and I have 18 staples inside me.
That is a really distressing story, and our prayers are with you. And I hope that we all hope that you get the attention that you have earned. John, thanks for joining us this morning.